Hi students, welcome to the sessions in oral pathology. I'm Dr. Gopi Krishnan discussing with you oral pathology. So we are studying about developmental anomalies, right? So in this video, we will be learning about developmental anomalies in the number of teeth. Okay, so we are very particular about the number of teeth, right? We have 20 primary and 32 permanent dentition, right? Permanent tooth and incisor, canine, premolars, molars. Okay, we have fixed numbers of tooth. Okay, so by the development, during the development, if there is any alteration in this number, okay, we may lose a number or we may gain a number. Okay, it means we may get an extra tooth or we may lose a normal tooth. Okay, so this alterations in the number of the teeth. Okay, so you should be knowing certain terms called uh, anodontia. So agnathia for jaw, aglosia for the tongue. I know dontia. It is related to your teeth. Okay, so the term you are familiar. Anodontia, when you have no tooth at all. Okay, there is no tooth in the oral cavity. We call the condition anodontia. Now, uh, what we say, a 2-month-year-old child doesn't have any tooth in the oral cavity. Okay, do we say that anodontia? It is anodontia. Okay, or a 80-year-old grandfather. Okay, you have an 80-year-old grandfather. He has extracted all the tooth from his oral cavity. So, do we tell him that he is having anodontia? Okay, so there lies in the use of the terms. Anodontia means that there is no tooth in where it should be normally seen. Okay, in your age, in our age, you should have this much set of teeth. But still, if you don't have any teeth, we call the term anodontia. So if a tooth is not erupted, the tooths are there, and it is not the age, a 2-month-old child. The tooths are not erupted. Okay, so we call the term pseudo anodontia. Pseudoanodontia means the tooth is not erupted yet. Tooth is not yet erupted. It is there. It will erupt when the time comes. Okay, and for our grandfather, where he had the tooth, he had extracted it already. We call it a false anodontia. False anodontia, where we have anodontia due to tooth extractions. Okay, tooth is extracted. Okay, so this is the use of the terms. Okay, now do you know the term called hypodontia? What do you mean by hypodontia? There's a term called hypodontia. Okay, so lack of, if the person is lacking lack of one or more teeth. If the person is having losing or is not having one or more tooth, he is not having one or more tooth, we call the term hypodontia. So when will we call it as oligodontia? Okay, oligodontia. If the person lacks 6 or more tooth, okay, lack 6 or more tooth, we call him by the term the person is suffering from oligodontia. Okay, and when we call the term hyperdontia, whenever we are having an extra tooth, we call it hyperdontia. That condition is called a supernumerary teeth. Okay, they're having extra dentition or extra tooth. We call the term, the common name is supernumerary. Supernumerary teeth is the common term for hyperdontia. Okay, so hypodontia is a lack of one or more tooth. Okay, if it is 6 or more tooth which is lost, we call it as oligodontia, and if we have a extra tooth, we call it hyperdontia or we supernumerary. So there was an interesting INICET question. So we learned all the terms, and we are now going for the exam and see how this INICET people has asked the question. So imagine a person is having a person is lacking his first and second premolar. Patient lack his first and second premolar. Okay, but he is having one, but have one or two supernumerary teeth. Okay, what will you call this condition? The person is lacking his premolar. one or two premolars he is lacking. Okay, imagine his maxillary premolars, yeah, or your mandibular first premolars, or your maxillary first premolars, that is missing. That is not there. So if one or two tooth is missing, we call it hypodontia. But he's having supernumerary teeth here. Okay, even he is lacking premolars, but he is having supernumerary teeth. So what is the condition we call for supernumerary teeth? It is hyperdontia. So here there is hypodontia and hyperdontia in the same person. Okay, so what you call the term? The term was asked in your INICT exam. You can see it in the previous question paper. That condition is called a hyperdontia, and this was not in the option. The other name of this was there in the option, that is oligopleodontia. Oligopleodontia was there in the option. So this is the term where you have a lacking, you are lacking some permanent dentition, and but you are having extra supernumerary teeth. Okay, so this is called hyperdontia or oligopleodontia. Okay, so this is the question why I have explained you each terms. Okay, hyper, because they have asked question. See, it is very simple. Okay, these terms we may feel that it is so simple or so silly, but INICET need people, they ask very basic questions. Okay, most of the questions will be very basic, which we will try to what omit. But there lies the problem. Okay, if you are missing one basic question, you will face a difficulty in cracking it, because most of the students now they will not miss basic things. Okay, we should be thorough with basic. Okay, a bouncer question will be bouncer for every person. Okay, for every student a bouncer question will be a bouncer. Okay, there is less chance, but basics will give you good score and a good rank. Okay, if you are clear with your basics, you are definitely in a government seat. You can crack NEET and you will be basically definitely getting a government seat. And if your preparation is so hard and so smart, if you attend more, then you can get a seat which you choose. Okay, you will be in a rank so that you can choose your stream. Okay, I want endo, I want prosto. Okay, so for that, one thing, your basics should be strong. Along with that, you should have an extra reading and extra knowledge. Okay, but for students who are focusing that, okay, I want to get a government seat in any college in India, I want to crack NEET, I want to get a government seat. Okay, then the basics itself, if you're thorough with the basics, you can get it. I'm so confident. I assure you that if you're clear, thorough with the basics, you can definitely get a government seat. Okay, so this is one thing. Now we have certain questions which is previously asked in this number of teeth. Okay, anomalies in the number of teeth. Which are the genes? What are the gene mutations? Okay, which all gene mutations can cause this hypodontia? Hypodontia. If you have some gene mutation, that can cause hypodontia. Okay, so one gene mutation I think you are very familiar with if you have a good revision. Okay, we have discussed a one gene mutation where you have cleft lip with hypodontia. Okay, please go back and revise. Okay, or you can try your memory now. Okay, give an exercise to your brain. We have discussed one gene which has hypodontia along with the cleft lip. Okay, that is MSX1 gene. MSX1 gene is a very important gene. Okay, that is causing hypodontia. Then you have PAX9, AXIN2. Okay, so please remember certain the names of certain genes. MSX1 is very important, where you have cleft lip and your hypodontia. Okay, hypodontia. Okay, so these are certain genes. Now, which teeth is usually missing? So that is a very famous question. Which tooth is usually missing in the oral cavity? You know, the third molars are the most common tooth which is usually missing in the oral cavity. But third molar, if there is no option in the third molar, then it comes the second premolars. Okay, usually third molars will not be there in the option, because every student will guess that the third molars is having problems. It is the most commonly missing tooth and all. Okay, so Third molars will usually, they won't put in the options to confuse you guys. The missing tooth, most common missing tooth is the third molar. If third molar is not in the option, go for second premolars. Okay, second premolars is the second best option or the best option. Then comes your lateral incisors. Lateral incisors. Then comes your mainly the second premolars will be mandibular. Okay, mandibular. Then comes your what? Then comes your central incisors. Okay, and very least these your canines. Canines are least missing. Okay, canines are usually they don't undergo missing. Okay, so hypodontia, we have seen the type different terms we have seen. We have different genes we have seen, and most common teeth. Okay, that's all we have seen. Now let's see the term hyperdontia. Hyperdontia is a term which is used for supernumerary teeth. Okay, supernumerary teeth. Now, hyperdontia is called supernumerary teeth. Now, there is excess tooth. We have excess tooth here. Okay, so when the dental lamina is developing, you know that the tooth is arising from the dental lamina. So when the dental lamina is dividing and making tooth, any defect in the what initiation stage of your dental lamina, I repeat, the initiation stage of your dental lamina, it will initiate another tooth bud also. Okay, so one dental lamina that will give rise to one tooth, but from that one tooth is arising. But in the initiation stage, if the dental lamina is initiating yet another tooth, but what happens, that will also develop to a tooth, and that will cause another a tooth, that is a supernumerary tooth. So the excessive tooth is due to a excessive activity of your dental lamina. Okay, excessive activity of your dental lamina, very simple. Okay, and this hyperdontia most commonly comes in the maxilla. Okay, maxilla, 80% of the cases we have a hyperdontia in maxilla. Now, there is a classification of hyperdontia. How this hyperdontia is classified? Okay, so that is a very favorite NEET question. Okay, in the NEET they usually ask which type of hyperdontia it is. Okay, so let's see. It is very simple. If you see supernumerary teeth, you take supernumerary teeth according to the location. Okay, according to the location where they are seen, they can be of three types. One is your mesiodense, and other one is your distomolar, and one is called your paramolars. Okay, so this is based on the location. Okay, based on the location, supernumerary teeth are of three types: mesiodense, distomolar, and paramolar. Mesiodense, as the name indicates, in the mesio, in the midline. Okay, in the mesio. So in between the central incisors. In between the central incisors, we have the mesiodense. Okay, and distomolars is distal to the molars. Distomolars, that is distal to the molars. Okay, distal to molars, or it is just like a fourth molar. Okay, or it is towards a distal end. Paramolars means buccal or lingual to the molar on the para side. Okay, so you have paramolars, it is either buccal or lingual to molar tooth. Okay, so if you see, if there is, so imagine this is two central incisors. Okay, and we have a supernumerary teeth in the midline. Okay, so this is mesiodense. Okay, and what about the distomolars? Okay, I have a molar tooth here. Okay, I have a, this is one molar, and this is my second molar, and this is my third molar. Okay, imagine, and I have a tooth, and I have a supernumerary tooth here. Okay, so this is the distomolar. This is distal to the molar. Okay, and if a tooth is here on the buccal side or lingual side, okay, here, then we call it as a paramolar. Okay, a paramolar in the buccal or lingual side. So this is based on the location. Now based on the shape. Okay, so based on location, which is the most common is your mesodens. Okay, the most common variant of your supernumerary teeth based on the location is your mesodens. Okay, now comparing the mesodens based on shape of the supernumerary teeth. So what shape it can take? It can take a conical shape. Conical shape means it will look like a conical or peg shape. Peg shape. Okay, the peg shape, it will look conical like this, or it can look like a tubercle. Okay, it can look like a tubercle. Tubercle, or it will look like a tubercle, or we say parallel shape. Parallel shape, it will look like this parallel shape. Okay, looking like a parallel. Then third one is, it is looking like a molar. It is called a molariform. Molariform means this is looking like a molar tooth, just like this. It will have multiple cusp and all. Okay, just multiple cusp and all. It is looking like a molar tooth. It's called molariform. So it can be conical, it can be tubercle, or it can be molariform. And conical is the most common shape of a supernumerary teeth, which is steak. Okay, so this is about the supernumerary teeth or the hyperdontia. Okay, hyperdontia. And you may have heard about many syndromes where you can see supernumerary teeth. One syndrome which is very easy for you, your Gardner syndrome, where you have multiple supernumerary teeth, right? There are other syndromes also, cleidocranial dysplasias. Okay, your Ehlers-Danlos syndrome. There's so many syndromes, Strouge-Weber syndrome. Okay, many syndromes are there where you can see your supernumerary teeth. Okay, so I will show you the image here. Okay, I have an image here to show you. Okay, you see this image. I hope this image is clear to you. Okay, so in the image you can see that we have a central incisor here, and we have a central incisor here. In between that you can see this tooth, and that is a supernumerary teeth. Okay, that is called a mesiodens. This is a mesiodens. This is a mesiodens, and the shape is conical. You see the shape, it is conical in shape, and it is a mesodent. And if you see this second image, you can see this area. You can see that there is an extra tooth here, which I am pointing the arrow. Okay, I will magnify it for you. Okay, so you can see that there's an extra tooth here, and that is towards the palatal side. That is towards the palatal side of that molar. Okay, so which type of tooth is it? It's a paramolar. Okay, paramolar. So in the radiograph also you can see that, and there's an extra tooth in the palatal side. Okay, so this is a paramolar. This is not a distomolar. If it was a distomolar, it was come in the extreme end, right? After the third molar, it will come paramolar. This is on the buccal or the palatal side. Okay, buccal or the lingual side, or we say the buccal or the palatal side. Okay, so this is a paramolar. Okay, I hope this is clear. This is the thing. Okay, so this is about the anomalies in the number of teeth. So we have seen anodontia, different terms: anodontia, false anodontia, pseudoanodontia, okay, hypodontia, oligodontia, hyperdontia, oligopleodontia. Okay, we have seen, we have discussed many terms and the related questions. Okay, so that's about your anomalies of the number of teeth. See you in the next video with the next topic. Thank you.